Endocrine surgery. What to expect the day of your surgery. In this video, you will learn what to expect the day of your endocrine surgery. This includes how to prepare the day of your surgery, how long your surgery will take, what happens after surgery, and what happens at discharge. How to prepare the day of your surgery. Do not eat anything starting at midnight the night before your surgery. You can drink clear fluids, such as water, 4 to 6 hours before your surgery. Arrive at the hospital at least 2 hours before your surgery to check in. Please note, the time of your surgery is only an estimate. If your surgery schedule changes, someone will call you. Be near your phone on the day of your surgery in case there are any last-minute changes. After you check in, a nurse and your surgeon will visit you. They will go over your surgery and answer any questions you may have. Sometimes surgeries are delayed if there is an emergency. This does not happen often. If your surgery will be delayed, your healthcare team will rebook it for the earliest possible time. This may be later in the day or on another day. You will then see the anesthesiology team who will review your anesthesia plan and answer any questions you may have before you are taken to the operating room for your surgery. Once you are taken to the operating room, the nursing team will take your relatives to the family waiting area. Safety in the OR. Your surgery team has measures in place to keep you safe when you are in the operating room. Before surgery begins, your team will stop and review your surgery plan out loud. This is called the timeout. After surgery and before you leave the operating room, the team will discuss what happened during the surgery. They will also make sure all surgical instruments, sponges, and small items have been counted and taken care of before you leave the operating room. How long is your surgery? Your surgery may take longer or shorter than planned. Endocrine surgeries can take 2 to 6 hours to complete. The length of your surgery will depend on your type of surgery, such as thyroid or parathyroid surgery, or other health problems you may have. The time it takes for the anesthesiologist to put you to sleep before surgery and wake you up after surgery, and the time it takes for your surgeon to perform the surgery are all included in this time frame. To help you breathe during surgery, a breathing tube will be put into your throat. During surgery, anything that is removed from your neck, for example tissues and samples, will be sent to a pathologist for review. The pathologist will send a report to your surgeon with their findings. Your surgeon will discuss the pathology results with you at your follow-up appointment. If you review your pathology report online through MyUHN, you will have to wait until you see your surgeon in order to discuss these results. What happens after your surgery? Your surgeon will let you know that your surgery is finished and you have been taken to the post-operative recovery room. You will stay in the recovery room for 1 to 2 hours, then be taken to another room on the ward where you will stay until you are able to go home. If you are enrolled in the short-stay thyroid surgery program, you may be able to leave the hospital the same day as your surgery. After your surgery, you will be moved to a short-stay bed to rest. A member of your healthcare team will check in with you before you are discharged. They will answer any questions you may have and make sure you are ready to go home. If you do not go home the same day of surgery, you may be able to stay till the next morning. Please talk to your surgeon regarding this discharge status. After surgery, most people will be able to eat and speak normally. The side of your neck and face may feel numb. The numbness can be felt as high up as your earlobes. This is from the local anesthetic. This numbness will improve after about 8 hours. You may feel numbness around your wound and your neck. This is normal and may last for a few weeks or months after surgery. After the surgery, the breathing tube will be removed and may make your throat feel sore. You may also feel a bit of pain from the cut made in your neck. Take Tylenol if you are in pain. Throat lozenges can also help with your sore throat after surgery. You can buy the throat lozenges from your local drugstore. Before you leave the hospital, your doctor may prescribe stronger pain medicine in case you need it. What happens at discharge? Before you leave the hospital, your nursing team and your surgeon will make sure you are ready to be discharged. This includes making sure you can eat normally, your pain and upset stomach are controlled, and that you do not have any signs of neck bleeding. Your team will give you the information on what to expect after surgery. A drain is used in some patients during surgery. It is a tube connected to a plastic bottle used to remove excess fluid. Most patients do not need a drain. If you do need one, it may be removed before you are discharged. Your drain may need to stay in after you leave the hospital. If this happens, someone from CCAC, for example a nurse, will manage your drain at home. Your surgeon will tell you if you will be needing a drain. The nursing staff will call you at home to make sure everything is going well with your recovery. If you have concerns, talk to your nurse or surgeon. If you have trouble breathing and your neck swelling is increasing, please go to your nearest emergency department or the Toronto General Hospital. If you have other questions, call your nurse navigator or surgeon's office. You have come to the end of this video on what to expect the day of your endocrine surgery. In this video, you have learned how to prepare the day of your surgery, how long your surgery will take, what happens after your surgery, and what happens at discharge. Please watch the next video to know what to expect after your surgery.